Hi, I'm Launi with All Things Divorce Podcast, and today we have here with us is Dr. DiCarlo. Dr. DiCarlo is a forensic counseling psychologist licensed in the state of Arizona, and today we're going to talk about his intensive family transformations program, or IFT is what we're going to call it, I think, throughout here. I'm really excited that he's here. I know he and I have kind of had some hit and miss in trying to get this scheduled, then rescheduled, then finally we're here. So thank you so much, Robert, for being here.
Thank you so much, Launi, for having me.
Okay, so a little bit about Dr. DiCarlo is he is a forensic, like I said, forensic and counseling psychologist licensed in Arizona. He operates a private practice in Phoenix, Arizona, specializing in family court matters. Dr. DiCarlo primarily focuses on providing outcome-informed therapeutic interventions and reunification for parent-child contact problems, and we'll address that definition, I think, during this, because that is a little bit of a sticky name, I think, now, right?
Yeah.
Okay, so he's the co-owner and developer of Intensive Family Transformations, and it's locally operated in Arizona. He also serves as an expert in the area of parent-child contact problems, parenting time, and other custody-related matters. Dr. DiCarlo strives to provide balanced evaluations in custody and parental fitness proceedings. He works effectively and compassionately with high-conflict parenting dynamics, as well as therapeutic issues with adults, adolescents, and children. Dr. DiCarlo regularly presents at professional organizations and groups in his area of expertise, and is the current president of the Arizona chapter of Association of Family and Conciliation Courts. That's the AFCC, Arizona chapter. Dr. DiCarlo has been appointed by the Maricopa, Pima, Coconino, and Yavapai County Superior Courts over 100 times in expert roles that include therapeutic interventionist, court-appointed behavioral interventionist, that's COBE, which I'd love to do a program on that also one time. Independent psychological evaluations, comprehensive family evaluations, focused assessments, limited family assessments. As always, listening to this podcast does not create an attorney-client privilege with me or doctor-patient relationship with Dr. DiCarlo. We are only licensed to practice in Arizona. However, Dr. DiCarlo is licensed to do telepsychology in other states, jurisdictions, and the information that we're sharing is really useful for all jurisdictions. And the program that we're going to be talking about, Dr. DiCarlo does get clients in from other states. So welcome, Dr. DiCarlo.
Thank you so much, Launi, for having me.
Okay, so I'm really excited about this program, and I'm excited that you guys came up with this. I think it's going to be really helpful to so many families. And I think Arizona and probably other states really need this kind of program. So let's talk about what makes IFT different from the other programs, the other, I don't know, reunification type of programs.
Sure. So Intensive Family Transformations, or IFT, is a collaboration between myself and two other local psychologists, Dr. David Weinstock and Dr. Raymond Branton. And each of us individually run private practices where we work with families where a child is resisting or refusing contact with a parent. And we refer to that in the field as a resist-refuse dynamic, or parent-child contact problems. And what we found is that doing those processes with families individually has been very challenging, because the families present with very complex dynamics, complex problems. The solutions are very complex. So we found that collaborating and working together under a more intensive format has been very helpful in achieving better outcomes for families that are facing these types of problems. So what we do is we meet with the family over a week-long period, 4 to 5 hours per day, and really confront and address the difficult dynamics in the families head on. We also include the entire family, so both parents, regardless of who the child or children is resisting or refusing, which is different than some of the other programs that some of the listeners may have heard about, especially in social media today. And we work, again, collaboratively as a team. We have multiple clinicians addressing these family dynamics together in a dynamic and creative way.
So, I'm glad that you mentioned the social media, because I had sent you some articles, and one of the things that you and I had talked about was some parents don't even know that they're doing these stupid things that are causing maybe some resistance to go to the other parent, whether it's a loyalty conflict or other things like that. Look, as a divorced parent, I know I've done stupid things that have not always been great. You try and learn from those. You have to love your kids more than you dislike your ex. And I think sometimes they just don't know. Would you agree?
Yeah, I mean, you raise really valid points, Launi, and thank you for sharing some of your personal experiences. What I've found, and in my experience is, and I have a lot of compassion for these parents because they don't know what they don't know, is that when you're in a two household family, the tools and solutions aren't the intuitive ones sometimes. And so they don't know that they're making these mistakes, which is why our program and similar programs that really address the whole family system, we're able to confront those gaps in knowledge and insight. And in a lot of cases, at least in my experience, I found that parents welcome that information. They don't know that they're not supposed to say a certain thing in front of the child or allow the child to make certain decisions because of the impact it might have on the other household. And so when these parents realize, and they do have the capacity for insight, they're able to change those behaviors for the betterment of the family, for the children, for the family system as a whole.
And yeah, I completely agree. And I've had clients who, needed some coaching, needed just to understand the dynamics of what they were doing and how that was affecting the kids. And that really kids, I think, typically want to love the other parent. I mean, even if kids love their abusive parents, right? I mean, that's not typically something that that they don't want to do unless there's been some sort of intervention. And interestingly, something I used to say to judges when I was litigating is, look, if this same parent went away to war and came back, you wouldn't need reunification, right? Because typically, given the fact, if it was a relationship that was, one parent, or married, and they came back. But oftentimes when a parent goes away for some amount of time, all of a sudden they need reunification because the stuff that's been said is not necessarily positive. And I don't know that the parents are meaning to do that. It just seems to me that when someone goes away to war and they come back a hero, they're a hero. And when someone goes away for some other reason, whether it's jail or something else, or had to disappear or moved or did, made some mistake, whatever, the information the kids are getting might not be something that would help the relationship.
Right. And one of the things I love about working with you in my experience has been that you understand these issues like a clinician. And that's such a great metaphor. The difference in the kind of coming back from war story versus some of the families we're working with is it's all in the narrative. So how you present the information and how the children come to think about and develop a story around what is happening in the family and why we're having feelings about the other parent, those narratives can be shifted therapeutically. And that's what we're trying to do in programs like this, is really help the family develop a new, healthier narrative that fits with the context of a two household family. Otherwise, the children are inclined to develop what we consider or call loyalty conflicts, where they may feel compelled to support or emotionally support a parent to the detriment of their relationship with the other parent, or resist or refuse contact with the other parent. So you bring up some
that's points. I do share a lot of my stories on this podcast, and there was a time where my kids, thought that I was just sad and miserable, that I was sitting home doing nothing when they were with their dad. And I'm like, are you kidding me? I go see rated R movies. I go to bars. I go have lunch with my friends. I didn't want them to feel like they had to entertain me or feel like I was missing them so much that my life was just nothing without them. I wanted them to be able to enjoy their life with their dad, but not worry about what I was doing. And that really, I think, actually was a weird changing point for them, if you will. Like they suddenly felt like they weren't my everything, that right. and that they didn't have to be there for me to support me 100%. Does that make sense?
Absolutely. And it raises another interesting point about this, and that's that absent information is filled in by children with sometimes incorrect information. So when a parent has a knowledge gap in, oh, wait, I need to educate, or they don't know that they need to educate their children about these issues, the children will fill that blank information in, sometimes with something negative and unhelpful. So if they don't see mom and dad as balanced individuals, as a combination of maybe bad parts and good parts, they're not inclined, or as inclined, I should say, to develop a loyalty conflict or a resistance towards one parent. They can see mom as having flaws, and they can see dad as having flaws, but they don't elevate to the level of, these flaws are so huge that, I can't have a relationship with that parent.
So tell us how you came up with this program. How did you guys design this? Like, what caused it?
I think just frustration, really, to be quite frank, in that, these cases, again, are so complex, and to see families come in and do a 12-month or sometimes 24-month therapeutic intervention process where it's one solo clinician working with the family, trying to untie all of these really complex knots simultaneously, it's really hard to be effective. So I would say the families that come out of a general therapeutic reunification process, they're the ones that probably were going to be successful a lot of the time anyway. They just needed the extra push. It's these moderate cases that are really difficult, and of course the severe ones too, but we're focused more on the moderate cases where there is a good prognosis, but they need something more intensive. So really, banging your head against the wall as a clinician, not making progress, or seeing the family go back to court and litigate over therapeutic recommendations and keeping themselves stuck. It's just, in a lot of these cases, it's unmanageable. And so the idea was born out of, we need to do this in collaboration. There needs to be more than one set of eyes on these families, which also helps with dealing with issues, clinical issues around confirmation bias and not seeing all the angles and perspectives as the clinician. And really, the other piece is, it's really fun to work with your colleagues and help a family at the same time. And so the first few families that we've worked with together, there's a synergy that really is, I would say, effective, for the family too. They see what's happening, and we're all working together collaboratively. So, again, I think it was born out of this idea that we could be more effective together in these complex cases.
Yeah, I love working with my colleagues, so I'm sure it probably takes a lot of the stress off.
Yeah, you share the burden.
Yeah, that's a great way to put it. So who is this program meant for? You kind of said that you work more with the moderate. Who is this program meant for? And then maybe who is it not meant for?
So we've really focused our clinical window on the mild to moderate cases. These would be, when we look at resist refuse dynamics, these would be cases where the children may have very strong negative feelings towards one parent, a lot of black and white thinking around the issues that might have brought them to that place as a family. But we don't have necessarily what we would consider a pathological alienator. In other words, one parent who might have very severe psychopathology that is contributing to their maybe encouraging the children to not have a relationship with the other parent, where it's very unlikely for that parent to develop insight. Those programs, or those families rather, in the severe category may be more appropriate for a judicial intervention as opposed to a therapeutic one. So we're focused on that middle group, the moderate and sometimes the mild cases, where there is a fairly good prognosis and the issues are manageable. Some of the people or families that would not be appropriate for our program would be if there are unadjudicated issues around domestic violence or child abuse or sexual abuse allegations, where there hasn't been a finding of fact or a DCS investigation, because those families are likely to come in and, instead of working therapeutically, they're likely to use the therapy platform for litigation, which really is what they're doing in court anyway. And it's a waste of resources to do it in the therapy office too. So we're really focused on families where we can include both parties, mother and father, or if it's a same-sex couple or any sort of family dynamic. We want both caregivers, both parents, to be actively involved in therapy to, as we discussed before, develop that insight and fill that knowledge gap so that they can be the effective ones in changing the children's attitude and posture towards the other parent or both parents.
Yeah. And, one of the things we were talking about earlier before we went, started recording was the presumption that at least people without mental health issues, the presumption is that they love their kids and they want what's best for their kids. Right. And so sometimes people just need education on what affects their, whatever behavior they're doing affects the kids. Right.
Right. And education can only go so far. So there's a educational component for sure in our program, but we're doing psychotherapy. We are actively working on therapeutic issues, problems around maybe behaviors that the parent might have engaged in towards the children and the children's response to that behavior. And how do you, as we discussed earlier, develop a new story around those issues, but also what do you need to do emotionally to prepare yourself for change? Which is hard even on an individual level. So imagine the complex dynamics that you see in a family system where you have a lot of moving parts, where everybody has to change in unison with one another. It's a big ask, and they need a lot of support to do that. The other, I think, important realization is that a program like this it's a primer, it's a jumping off point. We're not expecting that we're going to fix, decades of family dynamics and problems in a week. That would be unrealistic and disingenuous. What we're trying to do is jumpstart or short circuit these problems so that they could, work effectively together, have a new set of tools, and continue on in some form of therapy or other type of intervention that will maintain that progress.
So, what surprised you the most about working with families in this capacity?
On a personal level, I'll just say it's incredibly fun. I mean, I know they're going through a really difficult time, but some of the kids that we've had in these come through our program have been fantastic. They're so wonderful to work with, and it's hard not to really connect with them and want to continue to work with them because they've just really, from my clinical perspective, it feels like they were asking for somebody to come in and help their family. And when you see that and you watch the transformation and change in the system, in the family system, but also with the children and seeing the relief that it brings, it's really, really rewarding. So that surprised me. The other thing is, that the families seem to relax throughout the week. So they come in with a lot of resistance, a lot of maybe fear, confusion, questions. And over the course of the 5 days, we see a relaxation, we see a leaning into some of the tools and strategies that we're trying to educate them around. And that's been really wonderful to see.
So what might families find like the biggest challenge of participating in IFT?
That's such a great question. The ones that stand out to me are fear and trust. I think getting in the door is the hardest part. These families have probably been through sometimes years of and tens of thousands of dollars worth of litigation. They may have had failed previous interventions through professionals that may have done everything correctly and by the book, but still had been unsuccessful with the family, or worse, maybe made some mistakes along the way and it harmed the family. And so these families come in distrustful from the get-go. And that's really hard to ask them to try again, to really put some trust or effort into the process, and that we're not here to keep your family apart. They sometimes come with unhelpful narratives and beliefs about clinicians and professionals who work in family court arenas. as we've seen more and more in social media, and some attention around what they're calling reunification camps, where there's a belief that children are being, swept up and kidnapped in the middle of the night and thrown into these intensive camps. First of all, we don't do that. We include the whole family, and we don't kidnap children, of course. But that fear, and they may have received that information through different avenues like social media. And so they come in expecting one thing, and the first day is just about helping them relax and understand, we're not here to hurt your family. We're here to help you get to the other side and have changes in the system and improved interrelationships within your family, and also support the court orders, which they may not be following the parenting plan, and sort of getting their buy-in to understand that the parenting plan is there for a reason. It's there to help lower or lessen conflict. And if we can get some buy-in to that, your family will be in less distress.
So do you set a goal for them from the get-go? Or does the court set the goal? I'm huge on setting goals, right? I need to know where I need to go so I know how to get there. And so do you guys set goals at the beginning? What does that look like?
Well, a hallmark of any therapeutic or psychological process is goal setting, right? You have to have a roadmap. You have to know where you're at now and where you need to be. So our higher level goal is the court's goal. The court is always ordering, or in most cases, I should say, ordering the family to participate in the program so that the children can get back on the desired parenting plan. So the higher order goal is always, and the highest outcome is the family back on the parenting plan by the end of the intervention or shortly after. That doesn't mean that we don't have and help collaborate on additional goals to help the family get to that point. So maybe some of the barriers for the children following the parenting plan is they're afraid of mom, or they're afraid of dad, or they have had an experience with one parent or the other that was really upsetting, and they got locked into their story about why that happened without having alternative perspectives or a problem or solution oriented approach to move through that issue. So we would develop a goal. How do we develop trust and understanding and communication between child and that parent? That would be a goal underneath the higher order goal of trying to get them back on the parenting plan. So the way I like to look at it is the goal is effectuating the parenting plan that's been ordered by the court, because that's the court's desired outcome. The objectives underneath that are improved trust, improved communication. Let's say a parent might have had issues with over disciplining a child because they had a certain parenting style based on their own upbringing that they thought was best for the child. And maybe it was, maybe it wasn't, but at the end of the day, the child didn't match with that parenting style. So we may be helping rehabilitate that parent in a way and giving them new parenting tools or skills to match that child's needs without any judgment that this parenting style was right or wrong. It's just not working. It's not adaptive for your relationship with your child. Then the other dynamic might be the opposite parent may be fanning the flames of that. Oh, the other parent has this terrible parenting style that is harming you. So that parent has to adjust their narrative too. And so those would be sub goals underneath, or objectives rather, underneath the primary goal.
I like how you say that the other parent might be fanning the flame on that, instead of maybe working together to do what's best for the child. Sometimes, and I know I'm going to be guilty of this at some point. I was guilty of this at some point in my relationship. It's just different parenting styles. You want to, it's hard not to have control over what you had control of when you got divorced.
Right.
And I think that was one of my, and so where me and my ex might have had different parenting styles when we were married, I now have zero control over his parenting style when he's there. And it's hard to let your kid just go into that if you think it's wrong. But two, if I were to say anything to him, of course, he's not going to think that that's a great idea, right? That's not something that he wants to hear from me. And so I love the idea of bringing someone in, not to tell him he was wrong, but just to be on the same page as finding the best parenting style. I mean, I'm sure I did lots of things wrong, but thankfully they're all adults now and they made it. But I think helping guide that to where you both are sort of, and I know that the difference between parallel parenting and working together, but even just parenting in a style that the child is, works for each kid, right?
Yeah. And I think that,
and then,
oh, sorry, go ahead.
No, go ahead.
I was going to say that sort of style difference, when pointed out, if you're able to adjust with the recognition that it's not a judgment, it's not a good or a bad, like it may have been really
Right.
great during the marriage, it's just not working now. So I love the idea of helping parents understand when a behavior is adaptive in one context and maladaptive in another context. In this new context, we have to find a different style or approach that's going to work for your family. And when you take the shame out of it and sort of shaming the parent about you're not a terrible parent, it worked at one point, it's just not working now, they're more likely to be flexible in their thinking and adjust and pivot to meet the needs of their child.
Right. I think taking the blame away, taking that, that away is super necessary and probably super helpful. But I also had a question you had said that you usually get orders from the court. Are people able to come to you without a court order if maybe agreed by the attorneys and they enter into a stipulation, or through mediation where there's just been some difficulty between, maybe a parent and child and maybe, and I don't know how to say this without, like, maybe not alienation, but maybe appropriate resistance because of an action that a parent had taken, and they're trying to just, let's get this repaired. Yeah, you screwed up. Let's fix this. Can they come to you also?
Absolutely, Launi. In fact, we encourage those families. We do not require a court order to come to our program. I think our program would be a fantastic option for even a family facing divorce and separation, to develop some tools and skills and methods of communicating with the children and each other to launch them into a new paradigm for a family. And it's not that their family is broken or wrong or bad. It's that they have a new type of family, a two-household family. I have a house at mom's, I have a house at dad's. Not to say it's not going to be hard and there won't be strong emotions, but having a tool set or a toolbox to be able to address those problems preemptively and sort of as a protective measure could be tremendously valuable. And then in the other examples you gave, a family who is, post-divorce, maybe even post-decree, and having difficulties with a legitimate resist, refuse, justified rejection scenario where, parent A may have had some bad behaviors, but parent B is fully on board for helping that parent change and respond to the children differently. We would love families like that. And so don't limit yourself if you don't have a court order. But if you are involved in active litigation, we'll probably need a court order because not all parties may be initially on board to participate.
Yeah, and I mean, maybe this is a whole different podcast, but I always when I was litigating, would talk to my clients about the fact that I, as an attorney, can have a negative effect on the outcome simply because I need to tell them their rights. I need to tell them what I think the court will do. And that's my job. And they may be willing to settle for something less or something different. And there are also other attorneys who are very litigious and who just dig their heels in, and they don't want to try to do anything before the court order. They want to see what happens. And so is there any, and I know I'm springing this on you, but is there any advice you can give to attorneys on how maybe we can help during the litigation for our clients?
Yeah, it's a great question, Launi. I think that it's probably a difficult balance because, as you alluded to, you have to, your duty is to help them understand their their rights as a parent and what the possible options and consequences might be. I think what could be helpful in addition to that is helping parents with flexibility of thought. And I know that's not a attorney's job, right? But presenting maybe the full picture that even if you believe this to be true, and maybe it isn't even true, there may be a pathway to help remediate that issue that might not always be litigation. Because parents come in and there's a lot of anger, a lot of resentment, they've been hurt, they've been betrayed perhaps, and that is impacting their thoughts and the way that they're problem solving. And so the tool that they've reached for is a legal tool, and they've contacted an attorney and they're going to pursue some sort of litigation around some sort of contested issue in the divorce or separation. But there are other tools available. And so linking them up with mental health professionals that are collaborative with attorneys, which I would say a majority of the forensic professionals in our community are very much that way, that they might consider additional pathways that could get them to the same place, but with less money, with less frustration, and with a happier outcome for everybody.
So how has the community's response been to you launching this type of business here?
Well, my impression, and I could be biased here, but it's been very positive. I think judges and attorneys have been eager for a local option that doesn't just involve recommending or ordering a therapeutic interventionist to do reunification work with the family. And especially in cases where it might not be appropriate, because the issues are just too big to handle for a single clinician. So the feedback I've been getting from attorneys and other referral sources is that they're eager to send folks to our program. I don't know if you've had a different response, but it's been pretty positive.
No, actually, I think I've had the same response, and I mean, I'm thankful for it, just specifically because it's a local program. I mean, I know that you guys are willing to take people from out of state, and I think that that's great, but I love that attorneys don't have to send their people out of state, that the people can, that they're not having to completely uproot and go to Montana or Texas or wherever. And so I like that. And I also like the fact that, I'm familiar with the group, the people. I'm familiar with sort of what you stand for with the AFCC, and I've seen you work. And so I appreciate knowing that personally. I'm sure the other attorneys do too.
Thank you for that. I appreciate it.
And you're not a camp, correct?
Correct. And there may be misperceptions based on other types of programs. We're not a residential or inpatient facility or program. Families come to us, whether they're local or out of state, and they would still need to provide their own accommodations. They come, during the day for the 4 or 5 hour period, and then they leave at night. And that would be, again, the whole family, both parents and any of the children involved.
Okay. And so what else does that look like? So are they all for 4 hours, they're in counseling together, separate, both, either, depends?
All of the above. It's very dynamic. We have a general outline for the week that is established based on the needs of the family, but the general framework is that we do a combination of family sessions that includes the entire family. We break apart and do individual sessions with each individual family member and one clinician each. And then we do co-parenting sessions just between the two parents. In between those sessions, we have team huddles where the entire therapeutic team discuss issues that are coming up in sessions and strategies for how we can confront those issues with the family in an effective manner. And we repeat that throughout the week. And we have various therapeutic exercises sprinkled in for the family to engage in. We have a family dinner night midweek where we bring food in for the family and they share a family meal. That's also a therapeutic activity. So it's very dynamic, very engaging. There's not a lot of downtime for the family. So the majority of the time they're doing the difficult work and hopefully benefiting from that.
So it's significantly different in that from other programs because it isn't a camp. Are there any other differences between other programs?
I don't know and can't speak necessarily for some of the other programs' internal workings. What I can say about ours is there's a high level of collaboration amongst the professionals on the team, but also with the attorneys and the court. So we require an attorney call on the second day of the program of the morning of, so that we can check in with the attorneys, help them understand if one or both clients is maybe struggling and not fully on board. And then that attorney can then maybe counsel their client on what they might need to do to show up better for the program. So we address that really early on. On the third day, we ask for a status conference with the court so that we can do the same with the court and have the parties appear before the judge. And then we ask for a status conference on the back end of the intensive, which would be usually the week after, preferably within days after the program ends. And in that way, there's a lot of psycho-legal collaboration. So the court can help enforce and reinforce some of the things that we've been trying to accomplish during the week.
So the whole program is it 7 days, 5 days? How many days is the whole program?
The beauty of it is it's not a one size fits all. So we have a general framework that it's a 5-day program, and they typically come Monday through Friday, 2 p.m. to 6 p.m. But all of that is flexible. For example, we have a family we're working with now where we don't think they need the full 5 days, and we may limit it to 3 days. We may flex the hours in the morning or afternoon, depending on the needs. All options are on the table. It really just depends on the specific family.
Well, Robert, thank you so much for being here. I really appreciate it. I've been really wanting to talk, I've been trying to talk to you about this and learning more about your program for a while, because I do think it's a really necessary program right now, unfortunately. But there's a lot of divorces, and there's a lot of intense feelings, during divorce, after divorce, even before divorce. I do like that you said that you can help people before divorce. I think that's really great. That might be a whole separate program that we could do on what that looks like and how parents can help their kids sort of navigate through their divorce. Because there's 80%, more than 80% of the divorces are unrepresented. And so that's a huge number. And a lot of those people, even they might be getting along great. They might not have attorneys. They might not be fighting. But they still might not be doing a perfect job, but want to do a perfect job. And so I think this program would be great for getting people in and just sort of helping them navigate through that with their kids, so that, they don't do more damage than necessary, because divorce is hard. Divorce sucks, and it's hard for everyone involved.
Right. And, one of the barriers might be parents feeling overwhelmed. They don't know the available options. They're going through their own grief and emotions. To add one more thing to the mix probably feels like too much. And so educating families about, just like anything, if you are, preemptive and you try to address it proactively, it's going to be easier for you in the long run. But it's hard to get that message out and that buy-in.
Well, again, thank you so much for being here. I appreciate it.
Bonnie, thank you so much. It's been a pleasure appearing as a guest for you.